Information specialists for the aging, disability, and caregiver services really assist in sorting through the maze of services and programs. They help to analyze a situation as much as possible over the telephone and then provide good advice about which service or program will best fit your needs. Sometimes older adults have complex problems such as medical conditions, financial hardships, and difficulty performing daily tasks like bathing, shopping, or preparing meals. Some suffer depression, and many simply do not know that help is available. Care managers are social workers who are trained to help people sort out complex problems and develop a plan to address immediate and long-term needs. During the first home visit, care managers generally conduct an evaluation of a person's physical and mental status. They also assess financial means and the extent to which family and community support is available. Care managers also note if there are any safety issues in the home or if there are physical barriers such as steps or doorways that are too narrow for a person using a walker or wheelchair. When appropriate, the client's family also participates in the service plan development. The care manager's goal is to help the client remain as independent as possible. Ultimately, it's the client's choice whether to accept the services identified in their customized care plan.
We often get our referrals from intake, and once the referrals come to the offices, we will then go out to see the client. Oftentimes we try to get the family members involved, so we'll meet with the family members as well as the client to determine what services are necessary. We will go out to see if the client is in need of home-based care or if the client is looking for nursing home placement. I mean, there's a gamut of things that we're looking for, but initially just to see exactly what the client is asking for. The majority of our clients, though, that are receiving services are clients that are in need of some sort of home-based care.
Quite often, the care manager determines that in-home services are needed to help with daily tasks such as bathing, dressing, or meal preparation. When this is the case, the appropriate service providers are identified and service fees that may apply are discussed with each client.